Each tip package comes in a box with a 4-week supply and the package insert. Today we're using empty capsules for demonstration purposes. Each individual pack of tip contains instructions for use and a 1-week supply, which includes 7 blister cards, 1 card for each day of the week, and 1 inhaler in its storage case. Before beginning, the patient washes and fully dries her hands. Just before use, she removes the inhaler from its storage container by holding the base and twisting off the cover in a counterclockwise direction. The base of the case is put on a table and used as a stand for the inhaler. Next, she takes the blister card and separates the morning and evening doses. Each blister card contains 8 tip capsules. The contents of 4 capsules are inhaled in the morning and another 4 in the evening. The patient holds the body of the inhaler and unscrews the mouthpiece, setting it aside on a clean, dry surface. She removes the first capsule from the blister card and puts the capsule into the inhaler. She screws the mouthpiece back on. To pierce the capsule, she holds the inhaler with the mouthpiece facing down, fully presses the blue button, and then releases it. She exhales fully away from the inhaler. She places her mouth over the mouthpiece and inhales the powder deeply with a single breath. Removes the inhaler from her mouth and holds her breath for about 5 seconds. Breathes out normally and then takes a few breaths away from the inhaler. The patient again exhales fully and inhales deeply a second time to make sure the capsule is fully emptied, holding her breath for 5 seconds. Then breathes out normally again away from the inhaler. Once done, she unscrews the mouthpiece and removes the used capsule from the chamber. She examines the used capsule to ensure it is emptied of powder. If there were still some powder in the capsule, she would put the capsule back in and inhale again. We will now fast forward to the administration of the 4th tip capsule. Patients take 1 complete dose of 4 capsules in the morning and another complete dose in the evening, as close to 12 hours apart as possible, but not less than 6 hours apart. The inhaler is stored in its case and needs to be kept in a dry place along with the tip capsules. Tip capsules can be stored at room temperature. The patient has now finished 1 complete dose. She screws the mouthpiece back on, wipes the outside with a clean, dry cloth, and puts the inhaler back into the stand and case. At the end of each week, the inhaler and case are discarded, and the next week begins with a new device. The tip patient has now completed her entire treatment regimen, including cleaning the device, in a little more than 5 minutes from the start.